Hi, this is Dr. Eric Robbins, and I'm a board certified urologist and chronic pelvic pain expert in Southern California. And what I'd like to share with you is some of the mind-body tools that I incorporate in my chronic pain practice. So the first thing is, as a urologist, the American Board of Urology has certain guidelines for treating chronic pelvic pain. And when I see these patients, we always do the standard AUA guidelines and make sure that these patients are getting, the standard allopathic medical care they deserve. The challenge is that, lots of patients have had very good standard medical care and it hasn't particularly helped their chronic pain. Lots of patients have had all the tests and medications and physical therapy and things like that, and they're still having chronic pain. And so when I see folks like that, we kind of have incorporated some out-of-the-box thinking to help them get better. And so this is kind of where my thinking has evolved now. My sense is that most patients with chronic pain, whether we're talking about chronic pelvic pain or back pain or headaches or shoulder pain or chronic abdominal pain or any of those modalities, I think there's two things going on physiologically. One, seems to be that most of these patients are running in a chronic fight, flight, freeze physiology. Now, I'll tell you a story and how I came to understand this. Because in med school, it seems like they taught us, if you're out in the woods and the bear jumps out, or you're somewhere and a mugger jumps out, or you're molested, or whatever, we literally, you either fight the threat or you flee and try and run away, or if something's happening to a little kid, or, a soldier that's pinned down somewhere where you can't really fight and you can't flee and get away, people will physiologically freeze. But in med school, they teach us, assuming that you survive that incident or that your physiology is supposed to normalize and go back to normal. What we know right now is that's not really true. We know that as a result of either big T traumas, major stuff like a molestation, an abuse, neglect, some major medical procedure, some accident, you fought in a war, something like that. That's a big T trauma. Or as a result of little T's, just little day-to-day stresses and traumas, we know that can push our body and our physiology into this fight, flight, freeze state. And for many patients and for many people, that physiology will stay on a low level, like a computer program running under the surface. And what we know is that when folks are in a chronic fight, flight, freeze state, there's a few things going on. Number one, they're releasing a continuous amount of stress hormones, and stress hormones have a huge impact on sensitizing nerve fibers. And definitely with most of my chronic pain patients, that's a big deal. Their nerve fibers are hypersensitized, and I tell the patient it's almost as if those nerves are lying to you. Now, I'm not telling the patient the problem's all in your head, because I don't believe that. I think it's true that the message their brain's getting from these hypersensitized nerves is there's a real pain, a real issue. In my practice, I see a lot of folks with interstitial cystitis, and typically a big component of that, these people feel like they have to urinate frequently, sometimes every 5 or 10 minutes. They'll urinate and they'll empty their bladder, and they'll still have this nagging sensation that there's more urine left inside. There's pain with filling, sometimes pain with intercourse. None of those things are, quote, in their head. Again, it's true the message their brain's getting is they have to urinate every 5 or 10 minutes. That's nerve hypersensitivity. The other thing we've noticed with neuropathic pain, nerve hypersensitivity, I tell the patients, think of, if you've seen a pond of still water and we drop a pebble in the pond and the ripples extend out, concentrically, that when you have neuropathic pain and that pain's going on, that the ripples tend to expand out, and then you notice an area that was next to the area that's painful starts hurting. And then the ripples extend out further and further. That's kind of the nature of neuropathic pain a lot. Now, if we think that what I've noticed in my practice is that frequently the patients that develop these chronic pain syndromes, they have nerve hypersensitivity. I think that usually happens to folks whose bodies and physiology are in a chronic fight, flight, freeze autopilot. The second thing that happens generally with folks with chronic pain is that the muscles are tense and tight and spastic. And, if you've ever had a Charlie horse, that's really a spastic muscle can be severely painful. To even a lesser degree, though, if folks have chronic tension and spasm in the muscles, there's less blood flow, there's relatively less oxygen. That causes a very real severe physical pain. Now, So most of my chronic pelvic pain patients have some nerve hypersensitivity and have some areas of chronic muscle tension, particularly in the pelvic floor. Now, even for patients with, say, back pain or neck pain or musculoskeletal pain, a lot of the times a big source of that pain is still muscle tension and spasming. And it's interesting, and what a lot of physicians know from the literature, it's interesting because if a patient has chronic back pain, usually the doctor will order a test like an MRI scan, and invariably that'll show something like a slip disc or spinal stenosis or spinal arthritis. And usually the physician says, for example, it's that disc that's causing your pain. And maybe it is and maybe it isn't. So listen to your doctor. But what's interesting is that if you take 100 middle-aged people with no pain and you do an MRI scan, 65% have a slip disc, spinal stenosis, and spinal arthritis. And so it's not necessarily those anatomic findings that's causing the pain. What usually is causing the pain is chronic tension and spasm of the muscles in the neck, back, shoulder, buttock. Again, this is not a pain that's in someone's head. It's a chronic muscle tension and spasm, and it causes a very real physical pain. If you're familiar with the work of Dr. John Sarno, he was a physician, a professor of physical medicine at New York University, and Sarno used to see the worst chronic pain patients in the world. Most of his patients had had severe chronic musculoskeletal pain for anywhere from 10 to 30 years. Most of them had already had many surgical procedures and laminectomies and years of physical therapy and epidural injections and the whole gamut, and they still had their pain. And according to Sarno, if you looked at their x-rays, their imaging, they all seemingly had a good reason. I mean, he said, like their x-rays looked like the Elephant Man. So they seemingly had a good anatomic reason for their pain. What he found in most of these folks is it was rarely the slip disc, the spinal stenosis, the spinal arthritis, and what was usually causing the pain is chronic muscle tension and spasm. What we know is that when folks get stressed, a lot of times our musculature tends to constrict and contract. A lot of times the core muscles tend to constrict and contract. There's something that I explain to my patients that I refer to as a muscle tension and bracing pattern. And I'm going to give you kind of an analogy or metaphor for what that is. So I say, if you imagine a little kid, like little Johnny is 3 or 4 or 5 years old, and one of his parents or his dad's really, really upset and looking at Johnny and yelling at him. And of course, from the little kid's perspective, that can seem terrifying and overwhelming, even if it's not necessarily that big of a deal to the parent. So Johnny is just scared, witless, doesn't know what to do. We talk about a fight or flight response, but the little kid's not going to fight the adult and do much, and he's not going to be able to run away and get too far. So little Johnny will freeze, and certain muscles in different parts of his body will lock up and get tense and tight just to keep him from being overwhelmed. Now, a lot of times, those same muscle groups will just stay tense and tight, and I found that this can happen sometimes for years or decades. Now, sometimes, in the case of little Johnny, 20 years later, Johnny may be at work and his boss may be yelling at him or criticizing him, or his spouse or partner is doing something that's eliciting the same type of emotions that happened 20 years before, and the same muscle groups will lock up and get tense and tight. So every time Johnny's stressed or every time a certain type of emotion comes up, the same muscle groups will lock up and get tense and tight. That's what's called a tension and bracing pattern. Now, unfortunately, in standard medicine, to my knowledge, we don't have really good treatments to treat chronic muscular tension and bracing patterns. You can go to a massage therapist and they rub you and it feels very good. And then a couple days later, you go back to that same job or that coworker, that spouse, or that situation with your kid, and the same muscles will tend to lock up again. So what kind of mind-body things do I incorporate in my practice? So if we think that much chronic pain is due to nerve hypersensitivity and to chronic muscle tension and spasm and contraction, then it would make sense if we incorporate some techniques that help those two things. The challenge is there's nothing in standard medicine that I'm aware of that effectively switches folks out of a chronic fight, flight, freeze autopilot or that relaxes these muscular tension and bracing patterns. What I have found from my experience, which has been fairly extensive for the past couple of years, there's a technique called TREs. That stands for Tension and Trauma Release Exercises that I've been very, very happy with and I've taught a lot of patients with because I think that it does the two things that we're interested in doing for our chronic pain folks. One, it seems to, over time, turn off that fight, flight, freeze autopilot that so many of our patients are in. Our pain patients are in, our chronically ill patients are in, that I believe so many of our patients with chronic problems or functional problems, I think they're locked into a fight, flight, freeze autopilot. And the TREs also seem to unwind over time these tension and bracing patterns in the musculature. So briefly, how we think they work is this, and how I explain it to patients, I say, I'm sure you've seen on TV, or National Geographic or something, the lion chasing the gazelle, and most people have seen that, and that literally is a life or death chase for the gazelle, isn't it? What's interesting, if the gazelle escapes and gets to a safe place, what it will do, its body will shake and shiver and tremor. And they found that actually every animal and every mammal has a built-in shaking or tremoring mechanism in its body, and we think it does two things. The first thing, it seems to turn off the fight, flight, freeze stress switch. Okay? In this case, the gazelle literally ran for its life, and it has to have a way of down-regulating its physiology. In our case, we have traumas, and we're not able to turn off that physiology. And I tell the patients, listen, if somebody grew up in an abusive household, mom was being abused, you felt unsafe, you're being yelled at or criticized all the time, or you're being bullied at school, or God forbid you had some childhood illness or surgery, or that you were neglected when you were young, maybe even with good-meaning parents who may themselves have had physical or mental challenges or addictions or financial stressors or anything like that, the baby was neglected, that's a big source of stress. And I always say, if you grow up and when you turn 18, you finally get the key to your new apartment, the day you walk in that new apartment, it's not like all that stress and trauma that accumulated just suddenly turns off. Our physiology stays on this autopilot. So the first thing these tremors in these animals seem to do is turn off that fight, flight, freeze stress switch. The second thing, if you think about it in the case of the gazelle, 1 minute it's grazing and eating the grass, and then bam, there's the cheetah. And all of a sudden it starts racing at 50 miles per hour and it's zigzagging. There's a tremendous amount of survival energy and charge in the musculature, okay? If the gazelle escapes, these tremors tend to release that charge, that energetic charge from the musculature. If you don't do that, if there's a big buildup of energy associated with a lot of emotion and it's not released, it tends to stay in the muscles, and in my experience, it can turn into a tension and bracing pattern in the musculature. Okay, and then years later, the guy's wondering, why does my back hurt all the time? Well, your back hurts because there's something going on in your life and emotions coming up that you may not even be consciously aware of, or it's coming up and it seems so big or complex that you don't want to deal with it, or you learned as a kid it's not safe to feel certain emotions, particularly anger or anxiety. And so when our life tends to give us situations that elicit those emotions, these muscles clamp down unconsciously to try to protect us, to prevent us from feeling overwhelmed. So, this guy named David Berceli, he's a PhD, he's a therapist, he's a social worker, he's a body worker. He was a humanitarian aid worker in a bunch of different war-torn countries, and he happened to be in several of these countries while the war was breaking out. He was in some situations in which he developed post-traumatic stress disorder just from the traumas that he went through. And so he was trying to help himself. And he was also working in these war-torn countries where, if you imagine Syria right now, there's hundreds of thousands or millions of people who've been severely traumatized. There's effectively no therapist there. No one's got money for a shrink. There's not a Walmart or Rite Aid in every corner to buy Prozac. And so he was looking at this thing from a big humanitarian perspective, saying, how can we help these folks? And he developed a set of exercises that activates a shaking or tremoring mechanism in us, and he calls these the tension release exercises. So my experience with them using them with patients has been remarkable. Just to be clear, I usually combine these exercises with the best of what standard medicine has to offer. In my case, I prescribe a tremendous amount of tricyclics to help calm down hypersensitized nerves. We use a lot of physical therapy, anything else medically, obstructions or infections, tumors, etc. We, of course, treat that per the standard medical paradigm. But, it's interesting, the American Urology Guidelines for chronic pelvic pain and bladder pain, the first tier that we're supposed to do is stress reduction and relaxation. And so I've studied a lot of these methods to really take that maybe much further than a lot of folks. So the TRAs have been enormously beneficial in my practice. They're not a one-time cure, but over time it's a practice. I feel like it really helps shift folks' physiologies out of a chronic fight, flight, freeze state and into more of a parasympathetic, ventral vagal rest and digest state. I really think that patients heal better when they're in that state. There's a well-known cell biologist from Stanford named Bruce Lipton who said when our bodies are in stress mode, the cells are really just in kind of a survival state, and it's not till we shift into a parasympathetic rest and digest state that the cells really do a much better job with healing and regeneration. And I think all of us intuitively know that's true as well. Now, the question, we go back and we ask, why would somebody be in a chronic fight or flight state anyway? That's frequently due to somebody having experienced past traumas. And again, it could be developmental traumas, meaning things that happened to us when we were young. It certainly could have been an abuse, but it could even be just a neglect. A parent that was too busy to care for us or too distracted, or any one of a number of childhood traumas. And so, a lot of times when people have had a trauma, I see adults of all ages in my clinic, I'll ask, when you think about this thing that happened in the past, is there still an emotional charge on it? Like from 0 to 10, how strongly do you feel that? When you think about when you're molested at age 7, how strong is that emotional charge from 0 to 10? Where do you feel that in your body? How do you know that it's a 9 out of 10 in intensity? Okay? So there can be past traumatic memories that when they still have a big emotional charge on it, I feel like those memories where they're held inside our body-mind are kind of keeping us locked in a fight or flight state. There are techniques out there that allow us to clear the emotional charge off these past events. And frequently you can clear the emotional charge off these events at a deep enough level that patients get a physiologic shift and physical healing. So I'm going to share with you a case report of someone I had a few years ago. This was a woman in her mid-30s, and she was having severe pelvic pain, vaginismus. Her vagina and pelvic floor muscles would spasm and lock shut every time she tried to have intercourse. So she saw her gynecologist, and they referred her to one of my partners, who's a urologist, to make sure the bladder was not involved. And he checked her. The bladder was not involved. He said, "Did you ever have a history of any trauma?" She goes, "That's interesting you asked." She goes, "I was molested and penetrated by an uncle when I was 7 years old." So if you think about that, there's an event. There's obviously a big negative emotional charge on that event. It's very traumatic. I'm sure there was physical pain in the vaginal area at the time. When you have that combination, big emotional charge, unresolved emotional charge, combined with physical pain, the muscles will lock up and get tense and tight and spastic, and the muscles may not recognize that it's safe to let go until we clear the emotional charge off the past event. So in her case, I said, "When you think about that event, how intense is it?" She goes, "My God, it's a 10 out of 10. I said, "Where do you feel it?" She's like, "Right in the pit of my stomach." I did a technique called meridian tapping. It's a form of emotional acupressure. We tapped certain acupressure points. Literally about 15 minutes later, all of the charge was cleared off of that memory, meaning she could think about it. There was no emotional charge. She couldn't feel anything in her body, no charge. And we literally kind of got the message to her body that the war was over. It's safe for the muscles to let go and relax. And after that first visit, she was able to resume normal sexual relations, no pain, no problem. In fact, her boyfriend came to see me about a month later because he needed Viagra because she was apparently making up for lost time. But I see cases like this a lot. A past trauma. I had another patient recently who, when she delivered her first child around in her early 20s, had a really large episiotomy, where there's tearing or cutting of the vaginal wall to allow the baby to come through. And the incision went into the anal sphincter of the rectum. And that's an event. Now, even now, 20, 25 years later, when she'd remember back to that event, that first childbirth, the episiotomy, that was still a 10 out of 10 in emotional intensity. Do you think from all that that was done back there and stitching up the episiotomy and pain and spasm in her pelvic floor and pain with bowel movements, do you think there was some emotional charge on that event? Yes, there was. Do you think there was some muscle spasticity at the time? Yes, there was. And now, 20-something years later, she's got a lot of proctalgia, a lot of pelvic floor tension and spasm causing a lot of pain. So we did some of the techniques to help clear the charge off that memory, and she noticed almost a complete improvement in the rectal pain and spasm. So these are really two techniques that I use in my practice all the time. What I like about taking this approach, again, we're not telling the patient you're crazy, the problem's on your head, there's nothing there. We're telling them your physiology's off. It's probably locked in a low-level fight, flight, freeze autopilot that's causing nerve hypersensitivity, chronic muscle tension, and spasm. Those are the two ingredients that affect most folks with chronic pain. We've got some ways to deal with that now. The TRE, the tension release exercises, and meridian tapping, they're phenomenal. There's a couple of the techniques that I also utilize to help kind of clear the emotional charge of these past events. And I'll tell you, when you incorporate some of these mind-body techniques and help patients relieve their stress and relax physically, relax their musculature, a lot of times their body will heal itself. And I know as physicians, that's ultimately what we all want. I mean, we all know that, narcotics and opioids are just horrible for chronic pain. They probably make chronic pain worse. So it does involve some out-of-the-box thinking. I think we can communicate with patients about what their physiology is doing. And one last interesting tidbit, I spent the first 20 years of my medical practice with the idea that, our thoughts and emotions affect our body. I think most people agree with that. I think nowadays what the science is showing, and that's, by the way, a top-down approach. This affects this. But now I think what the science is showing is that the vast majority of our thoughts and emotions are coming from our body and our physiology. So we'll do a mind-body technique and calm down people's physiology, and they'll finish, for example, a TRE session, and all of a sudden they notice, hey, my mind has really slowed down. I don't have these crazy racing thoughts all the time that are driving me crazy and keep me up at night. And the second thing, they notice that their emotions feel a lot happier just by calming the physiology. Last thing I want to mention about chronic pain, most of you know this, pain generally has three components. There's the actual physical pain, and you can think of that, there's a sensation, a raw sensation in someone's body, right? And then there's their thoughts about it, and then there's their feelings or emotions about it. So three components, and they're probably one-third, one-third, one-third. I know in my practice as a urologist, have guys come in, they have some discomfort in a testicle, they may feel a little lump or cyst there, and immediately in their mind they're thinking, oh my God, I got cancer. So they have a discomfort, they may have a lump there. Of course, their way they're thinking about it is definitely fueling their stress. Their body's releasing more stress hormones. That sensitizes the pain fibers, and then the pain gets worse. Interestingly, usually these guys will come in and I'll reassure them. I'll say, listen, nothing serious is going on. There's no cancer. You have a little hydrocele or a sperm-filled cyst. That's nothing serious. It's not going to turn into anything serious. Most of those guys, just hearing that, don't really need pain medications, don't really need a spermatic cord injection. Just having that reassurance and helping to calm themselves down, the pain gets better. For chronic pain patients, if you get someone, for example, who can do meridian tapping, you can start helping people think and feel differently about their pain, and then help start to calm down that stress response, which will help them heal better and help the pain. So I hope this helps you, and let me know if there's any questions. My email address is hypnomd, hypnomd @AOL.com, and love to hear from you. Thanks so much.